Knobology for MSK ultrasound. This instructional video will allow you to become familiar with the basic ultrasound machine, understand the basic buttons needed to perform a scan, and learn to manipulate the buttons to improve the image quality. As technology has improved, so has ultrasound. However, understanding your instrumentation is important in creating diagnostic images. You should become familiar with the machine you use to help your technique. Do not be afraid to push buttons to see the effects of the function. You can always reset the application. The very first thing you must do is find the power button on your machine. It simply turns the machine on and off. Before beginning to scan a patient, you must enter some information. You will do this by using the patient button. This function allows the images to be stored under a particular patient. You may use New Patient to add an entirely new patient to the hard drive, or New Exam will add an exam to an existing patient. This screen typically allows the scanner to choose a few other machine functions, such as the application or the body part that is being imaged. You may also select the transducer here. A high-frequency transducer is used for superficial imaging, and a low-frequency transducer is used for deeper imaging. You may also use the exam button. An important component to diagnostic imaging is labeling the images, which makes image review easier. Labeling is done using an alphanumeric keyboard. This is used for annotating the screen or labeling images or structures. Some things that might need labeled are the side of the body that is being imaged, the body part, or the scan plane that's being imaged, or placing an arrow. Once you have an image that you would like to freeze, you will use that button. In this mode, you can use lots of functions, particularly the Cine button. This is using the trackball, and it rolls back your image several frames. On this particular machine, there are P1 through P3. These are image storage options. P1 is for DICOM images sent to PACS, P2 is for thermal paper printers, and P3 is for DICOM images to be saved to a USB drive. Before you move on to the depth knob, you must unfreeze the machine. Then you can use the clear button to erase the words. Notice the screen is adjusting. This is the depth control. We want the anatomy centered top to bottom and side to side. Your depth control adjusts the top to bottom. Here you see the sonographer using a split screen. This allows you to view images side by side. The left start will activate the left image, and the right stop will activate the right. You can toggle back and forth by simply pushing the button that you want to activate. When you are ready to store images side by side, push the freeze button. When you are ready to go back to B mode imaging or plain imaging, you just use the B button. The trackball is a multifunctioning tool. This is used in Cine or in placing cursors or measurements. The buttons around a trackball are typically high-frequency used buttons. You will notice that the trackball is a high-functioning tool. This is used for several things, one of them being Cine Loop that we already covered. It is also used in measurement calibration. It works like a mouse on a keyboard. One of these functions is the Enter button. This is also a multifunctioning tool. It is used for setting measurements. We mentioned a measurement tool under the frozen image. This button allows you to physically measure a distance on the screen. When you push this, it brings a cursor up. You use the trackball to place the cursor, then hit enter. Then you use the trackball again to place a second cursor and hit enter as well. You can put as many measurements on the screen that is needed. You may also change the shape into an ellipse if needed. You may use the clear button to clear the screen. Another button you may want to push is the cursor. This will activate a cursor on the alphanumeric keyboard. It allows you to move words to a new location so you are not covering any anatomy of interest or for personal preference. A critical function of the ultrasound machine is the gain button. This allows you to brighten and darken the screen. This is also known as the 2D gain or receiver gain. Notice the changes are uniform from top to bottom. Another important function on the modern ultrasound machine is color. Color is applied to a specific region of interest on a 2D image. This detects movement, such as blood flow through a vessel. It typically appears as red and blue and shows direction of flow. You may notice artifactual, unorganized color outside of the blood vessel. This is caused from motion. When you are ready to go back to regular imaging, you push the B mode button. A similar function is the PDI, or the Power Doppler Imaging button. This is used to add sensitivity or detection of slower blood flow. It is often used in small vessels. This shows up orange. B mode will take you back to general imaging. The next function is the TGC. This is the time gain compensation. Each slider is representative of a band across the screen. It allows for dark bands near the top of the image or lighter bands at the bottom of the image. These buttons typically are in a straight line, but remember, they are there to help you optimize your image. One of the most important functions on a modern ultrasound machine is the focus. This is also known as the focal depth. You can add the number of focuses, or subtract them, or move them top to bottom on your screen if you notice the hourglasses off to the right of the ultrasound image. This helps the sonographer get the best resolution at or below the level of those hourglasses. This button is the frequency button. This is used to adjust the frequency of the transducer without physically changing transducers. Notice the dial in the lower left image. It is changing frequencies. You may need to use some of the other functions on this machine, such as Doppler. However, you will need to be scanning a blood vessel for this to be useful. If you are doing injections, you may find the needle function helpful. This is a biopsy guide. It places a line on the screen for the practitioner to see where the biopsy needle will go if they are using the correct sonographic location. Jumping over to the zoom button, this helps us enlarge the image. There are two types of zoom. Right zoom, which is used from a live imaging. This rewrites with more pixels. Read zoom is used after the frozen image. This simply enlarges the image as is and makes the image very pixelated. Another helpful tool is the body marker. This places an image on the screen that is sometimes used in lieu of labeling the image. There are some other functions on the keyboard that you may see in other imaging. It is not helpful in today's lesson.